Hi, and welcome to A Sense of Wellness podcast, inspiring and empowering a healthier you. I'm your host, Susan Greeley, and I want to welcome you to 2025. It's a brand new year, and I'm excited to bring you more inspiring and empowering conversations on the 4 pillars of wellness: sleep, exercise, nutrition, and stress management. Today, I will be talking about all of the wellness pillars in relation to cardiovascular health with my guest. We'll talk about how and why we all need to think and act proactively about preventing the number one killer of both men and women, which is cardiovascular disease. I'm joined today by Dr. Tracy Paeschke, who is a highly experienced Double Board-Certified Cardiologist and health coach with more than 25 years of experience in the field of cardiology. After she dedicated many years to diagnosing and treating heart disease, Dr. Paeschke now focuses exclusively on prevention through integrative cardiology. So, Tracy, thank you for joining me today. I'm going to jump right in. You worked for many years as a cardiologist, treating patients with disease. When and why did you pivot to preventive cardiology? And tell us exactly what that is.
Sure. Yeah. Thanks so much for having me. I love to talk to people about heart disease and how we can prevent it. So I spent most of my career treating people's heart attacks and heart failure and arrhythmias. And then, after you do that for a long time, you realize that there's this 20, 30 years before people have those catastrophic events where we could have maybe been more proactive in helping people prevent those events from occurring in the first place. And, it's just hard to do in the typical corporate medicine cardiology practice, right? It's hard to focus on prevention because it's more of a reactive model instead of a proactive model. So, you get 15, maybe 30 minutes with a cardiologist once or twice a year. There's not enough time to talk about all the pillars of healthy lifestyle that you mentioned, right? And often people don't even get to see a cardiologist until they've had a problem or a symptom. So again, I'm helping people become more aware of the preventive piece. The American Heart Association estimates that 80 to 90% of cardiovascular disease is preventable through lifestyle modification. So that's a huge percentage, right? So even if you have a family history of heart disease or you have risk factors for heart disease like high cholesterol or high blood pressure, doesn't mean you're destined to have a heart attack. It means that we need to be very aggressive with your risk factors to keep you from having a heart attack. So that's what I decided to focus on a couple of years ago. Again, I think people are becoming more aware of the power of prevention, not just in cardiovascular disease, but to prevent chronic illness. The rates of chronic illness in this country are astronomical, and people are realizing, wait, I don't want to go down that path. I want to live to be 100, but I want to live to be 100 in good health, right? I don't want a lot of chronic diseases, and I don't want to be in a nursing home. I want to be able to be active and go hiking and play with my grandkids and my great-grandkids, right? So that's the point of it all. So that's what I'm focusing on now.
Nice. It's such a necessary pivot. I completely agree with you. We all know an ounce of prevention is worth a pound of cure, right?
Yeah. Yeah.
I'm going to repeat what you said, and I've actually mentioned this in the past on podcasts, is that 80% estimated, you said 80 to 90% of all cardiovascular disease is considered preventable. And yet it's still the number one killer of America.
Yep.
So there's a huge disconnect. We talk a good talk, right, about prevention. People aren't putting it into practice enough. And I want to ask you too, are we starting too late? So in your current practice working on the preventive side, do you work with people who are younger, say even in their 20s and 30s?
I don't have as many in the 20s and 30s. Usually it's around 40 where people sort of start thinking about these things, right? Because when you're younger, you're sort of invincible and doing your thing, right? But, it's never too early to start being conscious about your health, because a lot of the things that we learn as children even are what we do as adults, right? So if your kids are eating a lot of processed foods and not sleeping well and not exercising, those kids will grow up to be adults that often do those same unhealthy habits, right? Mm-hmm. So it's never too early to start. And then on the flip side, it's never too late to start either. I have people who have lots of blockage and plaque in their arteries, but they've turned things around. Their cholesterols are way down, their blood pressure, they lose weight by following a healthier diet, their blood pressure's down. So, it's never too early and it's never too late.
Awesome message. I see that all the time in my own practice and throughout my career. And that is a really important message to convey to listeners. Start now, regardless of your age. I have young adults, my kids, and we do talk about this, but, we're going to talk a lot about prevention, but I want to bring it to that treating of disease and reversing heart disease specifically. Again, this is a very, very big question. I just want a yes or no answer. Can we reverse heart disease?
Yes.
Yeah, exactly. I think so too. And how? So let's spend a little bit of time. You talked about that lowering cholesterol, various things, but can you give us some specifics on how we approach reversing heart disease in people who already have been diagnosed with some advanced heart disease?
Sure. So, Dr. Dean Ornish is a cardiologist, and he did some of the original work on this, right? So he took a group of people and he did an angiogram, right, a heart cath to look for blockage. And he put them in this program of, a healthy diet, regular exercise, and stress management. And then he did a follow-up angiogram, and he could show reversal of plaque and certainly not progression of plaque, right? So again, it's multiple parts. Most heart attacks occur in the setting of a mild blockage. So that's one thing that people don't always understand. So it's a mild plaque that becomes inflamed and unstable and sort of angry and ruptures. That's what causes an acute event like a heart attack or a stroke. Plaque rupture, usually in a mild plaque. So it's two different parts. So let's say someone has an 80% stenosis or blockage in an artery. Those tend to cause symptoms like chest pain. So somebody goes on a walk and they start having pressure in their chest, and we do some imaging and we see that 80% blockage. Well, sometimes still that can be treated with medicines, and if we can reduce symptoms, depends on where it is and other parts of it. But if it's a stable patient and they're having stable symptoms, we can put people on medication and reduce their symptoms, and they do fine. So as long as that plaque just kind of stays there and stays quiescent and is stable, and people can die of something else long before they die of that, right?
Right.
Now, again, it's the inflamed, unstable plaque is what happens. You hear this story all the time. Someone had a normal stress test, or they hike every day and they are in great health and they suddenly die of a heart attack, right? Mm-hmm. In that person, what happens usually is they have a mild plaque that becomes unstable, and the plaque ruptures, and all this stuff goes on in the artery, and it causes a blood clot, and you can't get blood past that blockage, and it decreases blood flow to the heart muscle, and that's how people died suddenly. So again, it helps to know, do you have mild plaque even? So not just do you have the 80% blockage that causes the symptoms, but what about the mild plaque, the 30, 40% plaque? Do you have any of that kind of plaque? And do you have any, it's called soft plaque, do you have any soft plaque? So again, we have the technology. It's 2025. We have the technology to look at all this, but we don't. Cardiovascular screening in the U.S. is weird. It's not like a mammogram where everybody gets imaging when you reach a certain age every year or two or whatever. Cardiovascular disease isn't like that. So usually people just get that standard lipid panel, and that's just like the tip of the iceberg, right? So they never know, do I have a plaque or do I have inflammation in my body? Because it's not just cholesterol with cardiovascular disease, right? It's cholesterol and it's inflammation. So not only is my LDL, but what about my Lp(a) and my ApoB and my NMR panel? Is my LDL is the big fluffy nice particles, or is it the small dense particles that are more atherogenic? Do I have inflammation in my body? Is my CRP high? So all these different factors go into building a picture of someone's personalized risk, right? So not just the old, well, your cholesterol's a little high, you better take a statin for the rest of your life, but your cholesterol's a little bit high. What do your advanced lipids look like? What do your inflammatory markers look like? What does your imaging look like? Do you have calcium in your arteries or do you have plaque? So that's how we build a personalized picture. And then that's how we address all the lifestyle pieces too, right? Because it's not just cholesterol. All those other things like exercise and diet and stress management and exposure to risky substances or toxins, all those pieces, sleep, if I didn't mention it, is what affects the inflammatory part of it, right?
Right.
So again, we have to look at all that stuff.
Yes. And I was going to bring back the sleep if you had not mentioned it, because all of these pillars, it's why we talk about them. They're all so closely tied together. And something that keeps coming up and again, as you're speaking, is inflammation. And inflammation is being the root cause of disease. It's like a recent podcast, I talk about inflammation and actually combating inflammation all the time. But how do we measure it, Tracy? Are there new screenings and diagnostic tools to actually look at one person's inflammation in their body?
Yeah, the best way is that HSCRP. So that is directly measuring inflammation. We know that a normal CRP should be under 1, even though sometimes the reference value on the lab won't say that, but really we're shooting for less than 1. We know that people's cardiovascular risk increases when their CRP is 2 or greater.
HSCRP.
So, yeah, HSCRP.
Who does this, though? I don't think it's done on routine labs. And why is it not?
You know, I don't know why. So you can ask your physician for it. Sometimes you might get a little pushback. But now, we have ways to get our own data, right? This is what I tell everybody to do is get your own data. So again, it's 2025. You should know all your numbers. So you can go to Function Health and you can sign up there and you get this very extensive lab panel and they have all these markers on there.
100 labs, I believe.
Yeah, that's right.
100 different tests. And then what do you do with that? Take it back to you?
Well, this is tough too, because again, in our healthcare system in the U.S., that you get 7 minutes on average with your primary care doctor, right? So if you bring these 100 labs back to your primary care doctor, it can be an uncomfortable visit because it takes time to go through all that, right? So really, I think the answer is you find someone like me who has the time. So I don't take insurance in my practice. So I'm not dictated by that, churning people through. And so I have time to sit down with people and go through all those. And I like to do it, right? I like to educate people about these things and about their health. So find someone like me who can, because they'll mark on there what things are out of range, and someone who has the time to sit down and go over. And what does that mean? What does that mean for you? Sometimes maybe it doesn't mean anything, but we just need to talk about it. It may mean something in regards to your other health history. So see, again, this gets back to the personalized medicine part of it, right? It's not just a number, but it's a number and then you and what's going on with you. So we kind of have to put it all together to paint a picture of your health.
And that time is an essential part of it, having the time with your physician. That's what we believe at CCPHP. So I'm happy to hear this. It is the way things are going. People need the data. They need to be empowered. They need their personal information and know where and how to get these advanced tests if it's required. And even beyond the Tesla. So let's take it back to more of the lifestyle factors, Tracy. Sleep, exercise, nutrition, and stress management are what I focus on in our wellness program. But obviously, there are other lifestyle factors that come into play as well. Beyond those 4, what else do you focus on with your patients?
So I use the pillars of lifestyle medicine, which are those 4 things you mentioned, plus avoiding risky substances. So not just, smoking and vaping and alcohol and marijuana and other drugs, but also toxins like plastic. There was a study out a few months ago. They found plastic nanoparticles in people's carotid plaques. So plastics and water and air. So all that, those are all toxins. And then the other big one is social connection. So we know that social connection is very important, especially as we age. People who live in the blue zones, the longest lived people on the planet, have a very strong social connection in groups. It just helps us stay healthy, mentally and physically healthy, where we have good social connections. So that's very important too.
I love that you bring those up. I had a conversation yesterday with a wellness provider talking about water and air in our own homes. And I think we spend so much time talking about the exercise and the diet and even sleep now. And it was a great conversation talking about testing our own water for, excess lead. And we don't have necessarily the healthiest water coming into our homes. And what's the air like that we breathe in our homes? Do you have mold or, there are a lot of environmental exposures. So I love looking beyond the obvious ones as well. That's why I asked that. And then now in society, we know there is a, epidemic of loneliness and then the depression and other issues that stem from that, the sadness, the grief. So this is maybe an unusual question, but how does that emotional stress impact the heart?
Well, we know that things like depression and anxiety and mental illnesses, again, it goes back to the inflammation piece, right? So those problems create sort of this stress in the body, right? So this chronic stress. Our bodies were meant to have this stress response. So if we have an acute stress, so a tiger jumps out at us, our blood pressure goes up, our heart rate goes up, this fight or flight, right? So we can run away and survive. That's the point of the stress response. But what's happened in modern society is we're bombarded with stressful things all the time. The news, finances, your job, your family, social media is just this constant stress that we're exposed to. And then similarly, that's where things like loneliness come in. If you're sad, if you're lonely, if you're depressed, if you're anxious, those things are stressful for the body. So what we have is this chronic stress. So chronic stress increases stress hormones like cortisol and adrenaline, which again increase inflammation in the body. So that's sort of the common pathway of it all, right? And don't forget, when you're depressed and sad and lonely, you don't feel like taking care of your health, right? You feel like maybe laying on the couch or sleeping or eating maybe unhealthy foods, right? So it's just your whole sort of focus on health is different. You just don't have the energy to do it. And the other part, there's that old saying is you're like the 5 people around you or whatever, right? So
right.
If you're socializing with people, let's say you join a gym and you're playing pickleball, you're socializing with people who have common interests and they're health conscious, right? As opposed to going to the local pub to socialize, right? So there you might be surrounded by people who are sitting and drinking alcohol and more the woe is me sort of mindset, right? So that's important too. So you want to get out there and you want to socialize, but don't forget to surround yourself with people you want to be surrounded by, right? Because that's important too. So whether maybe it's not the gym, maybe it's, you take a class to learn painting or something. So then not only is your brain working in new ways, right? You're learning a new skill. You're being creative, which lights up a different part of your brain. So that's good for your mental and physical health. And you're surrounding yourself with like-minded people. So you get lots of benefit in those ways.
I love that. Thank you for mentioning that. I'll summarize it as community and creativity as being good for our hearts, right?
Yeah, that's right.
Just thought of that. And we know that there's a lot of research behind it too. And I think that's a great tip and recommendation to start the new year is find some sort of creative outlet, whether it's updating your home, bringing in some flowers, but I think, painting, the arts, music, dance, all of those we know are very good for ourselves. Even cooking I encourage people to cook more and do some creative cooking. But funny, this holiday season, I have a college age niece who just was visiting and showed me she took a picture of a painting that she painted for her parents. And it brought us all to tears. It's so good. We didn't have the actual painting with her. And it brought me back to when was the last time I actually painted was when I had dedicated time before I had children.
Yeah.
I wasn't even aware of it. I call myself a painter, Tracy. It's funny.
Yeah.
Since I've had children, it's been over 22 years. I've not painted a single thing. So this is my reminder to everybody, tap into these creative outlets within yourself, because we know it really is good for managing stress. It's good for our brains. It releases all of these healthy hormones, right? And acts the cortisol. So I didn't know our conversation was going to go in that direction, but that's what I like about this, because the diet, the plant-based diets and all of that, we can talk a long time about specifics of that. And, but we need to go beyond diet and exercise, right? How do we truly manage the stress? And I think that's a big focus for all of us. And that can come through healthier cooking, and it does come through exercise. But I think most importantly, through the connections with other people that you like, and even surrounding yourself maybe with a new group of people. Don't you see too, right?
Yeah. Yeah. And, the other thing is, as we age, it's harder to make friends, right? And our social circles get smaller. So we really have to make the effort. And I think that's an important point. And that I try to tell people to do is because we tend to, especially women, you said it with the painting, and you haven't painted since you had kids, right? So we tend to put everybody else first on the list, and then our time, our self-care, because I would put that under self-care too, right? Painting, that goes last on the list. So you have all this other stuff to do, and then if you find an extra hour at the end of the day, you'll paint. Well, it's not going to get done, right? So I tell people, sort of like, business people have their CEO calendar where they put in their meetings for the week. Do the same thing with your health and your self-care. So in the beginning of the week, you make your agenda out for the week. So you put in your work meetings or your work hours, and then also plan your workouts or your painting or your meetup group, so you pencil those things, because most people, if they see it on their calendar, they just do it. They don't think about it, and they do it, and then they cross it off. And before you know it, you're going to your group. And so it takes away that thinking part of it. Oh, I don't feel like going to that meetup group today. I don't, so it takes that part out. It's just on your list. You just do it.
I love that. No, it's
so kind of a different way to think about it.
Right. Yeah. That's a great way to think about it. It is hard to create new habits, as we know. And like you said, the less you think about it and the more you just do it, the better you're going to feel, the more likely you are to continue and actually carve out that time. Because sometimes we just deprive ourselves of all those things that do actually make us feel better and help manage the stress. It's kind of crazy, isn't it?
Right. Mm-hmm. Yeah, because we're just too busy. But again, those things should be first on the list. I think if everybody put those things first on the list, we'd be healthier, we'd be happier. So just play with it a little bit. Okay.
A healthier, happier society, less disease that costs you so much time and money, and it's not about money, but I just bring that up as far as like healthcare goes. So let's push self-care to the top of our task list, our daily checklist, right? No, that's a real thing. What else do you like to prioritize in your approach with patients and, prevention in general? Talk any of the pillars.
I mean, I think they're all very important. Sleep is huge. There's new data that comes out on sleep all the time. It's just this, we've learned that our brain shrinks during sleep, and we have this system called the lymphatic system in our brain that sort of washes away the day's toxins. And we know that we should get 7 to 9 hours of good sleep. Most Americans don't get that. Because this segues to another important thing, wearables.
I was about to ask if you recommend them. I'm checking my data from last night.
Yes. So this is a great place to start, is buy some sort of wearable device. So a Whoop strap or an Apple Watch or a Fitbit, an Oura Ring, something that tracks your sleep. I mean, they track other things, but this is often the very first glimpse that people get that something's messed up with their sleep. Because you may think
their health, right?
Well, yeah. Yeah, with their health in general, but specifically with sleep. Because, you may think, well, I go to bed at 10 and I get up at 6, I get my 8 hours and I'm fine. Well, but what you might find is that it might be really only 6 hours of actual sleep, and you might not be getting any deep REM sleep or any deep sleep or REM sleep. It might all be just sort of light sleep, and that's not the restorative sleep. Your oxygen level may be falling during sleep, and that's probably from sleep apnea. So again, these red flags that you might see, you can take that data and with your physician, like if someone comes to me and they have these sort of red flags on their sleep data, I try to get them to do a home sleep study. That's just, again, sort of a first step to look deeper into it, right? But again, we spend a third of our life sleeping. We want to make sure we're sleeping well, because that affects not only our heart health. There are things like atrial fibrillation that are increased with poor sleep. Congestive heart failure is increased with poor sleep. Also, brain health is very important. Sleep is when our brain recovers, and people who don't get good sleep, there's increased risk of dementia. So we really want to make sure our sleep is good. It's huge.
I focus on it all the time. So,
yeah.
And I track my own. Yeah. I'll feel better when we sleep.
Yeah.
How does that? So you mentioned atrial fibrillation. I can't even. AFib.
Yes. AFib.
Is that actually worsened by lack of sleep? I did not know.
Yeah. So we know that people who have AFib, for instance, if someone has AFib and they undergo AFib ablation to cure their AFib, if they still have untreated obstructive sleep apnea, they're at risk to have recurrent AFib. So we know that sleep apnea causes changes in the heart. It can increase pressures in the heart. It can increase the size of some of the heart chambers. And those changes increase risk of developing AFib in the first place. Now, it's not the only thing that can cause AFib, but it's one of them. We know that sleep apnea can increase blood pressure, so it can make your blood pressure more difficult to control. So often people will come see me and they're on 4 different blood pressure medicines and their blood pressure is still high. We check them for sleep apnea. They have sleep apnea. We treat their sleep apnea, and their sleep apnea is better and their blood pressure comes down. So again, sleep apnea increases inflammation in the body, increases stress hormones. So it's a huge piece for that. So it has multiple effects besides just it makes you feel like crap. And you may not realize that's what it is. Because if you're always getting bad sleep, you don't know what it's like to get good sleep, right? So you have this chronic state of bad sleep, and then you just think it's, quote, normal, but it's not. But you're just used to it because that's all you know. And then if we take people and we improve their sleep, they're like, oh, God, I feel so much better. I have so much more energy. I don't need a nap in the late afternoon. I can go to the gym because I feel good, right? So again, it's multiple pieces. One thing affects the other thing.
All of those layers. I focus on that with people too, when I see how poorly they sleep. And then of course they're not exercising as a result.
Right.
And it's a shame, and they don't know what it feels like to actually feel good and feel
right. Yeah.
well rested. Yeah, it's amazing. You mentioned along those lines with the sleep apnea and the high blood pressure and all that. This is fascinating, and how it is all tied together and like chipping away at one thing at a time with the sleep. And I was just thinking about whether you focus on breath work with people or meditation or any of those other practices that can actually help with sleep or stress relief. And do you see improvement in people's sleep if they do implement some sort of breath work practice and or meditation?
Yeah. So I'm a huge advocate for meditation. There's a lot of data that regular meditation lowers blood pressure, lowers your heart rate, lowers stress hormones, decreases inflammation. So again, it's just part of this holistic health, right? It's good for our mental health, good for our brain. So yes, I try to get everyone to try meditation, and there are different apps. I recommend Headspace a lot, different meditation apps. Again, this stuff is accessible to people.
That's what I want to share, is that there is a lot that's literally at their fingertips. There's so much accessible to people without making some crazy investment of either time.
That's right. I think sometimes it can be overwhelming maybe for people. Absolutely. But if you just start with something small, even like diet, I advocate for a plant-based diet for lowering cardiovascular risk and risk of cancers and helping you maintain your ideal weight, decrease risk of diabetes, decrease risk of Alzheimer's. Whole food plant-based diet is the best diet you can eat. But that the average American eats meat at least once a day, often twice a day, right? And so that can seem like too much of a change to even think about doing, or any of these things that we've talked about they can seem like it's just too much. It's too overwhelming. So I try to get people to start with small changes. First of all, I try to get people to learn more about their health. So to go back to that, my body's a temple, and this is the only body I get. I need to treat it with respect and have amazement for all the things it does. So more of this like awe of our body. And so if you think of your body in those terms, it's harder to do a bunch of things that aren't good for you because you're thinking about it differently. You come from a different mindset. Well, maybe this soda, I know there's nothing healthy about it. I like it. It tastes good, but I'm not going to do that today, right? So again, it's just sort of a different way to look at things. And then just start like one thing, pick one thing. So maybe this week, you're going to focus on trying to eat more plants. So I tell people to start with a meatless Monday, right? So every Monday, that's your day you're just going to eat plants. You're going to eat any meat that day. So you're going to have fruits and vegetables and whole grains and beans and legumes and nuts and seeds. And, you're going to try some tofu or some tempeh. You're going to make a lentil loaf, right? You're going to experiment with different ingredients and different recipes. Again, you can get tons of stuff online. Forks Over Knives is a great resource. Start there and just make it fun. Make it, instead of your tacos with ground beef or shredded chicken, you're going to have tacos with a corn tortilla and some brown rice and some black beans and your salsa and your lettuce. And that's your taco, right? So you're not going to put a bunch of cheese and the sour cream. It's a healthier version. And just try it. You might find you feel better. Again, it's that thing of if you're eating the standard American diet every day, it might be making you feel bad, but you don't know it's making you feel bad because you're eating that every day. So if you go to a meatless Monday and you're eating just plants that day, you may find, I don't feel as bloated today, or I have more energy today, or I really like that tofu that I made. I never met, right? So again, it's just trying different things, making it fun, not like, oh God, I can't eat my steak today. I got to eat some kale. Again, change your mindset about it, make it more fun, kind of a challenge, but in a fun way.
Right. The fun is needed. And we were talking about getting creative. I love that you mentioned lentil loaf. I almost started laughing at that point because I have actually made lentil loaves as part of Thanksgiving for the vegetarians in the family. And everybody who's even non-vegetarian loves the lentil loaf.
Right. Right. But they wouldn't have tried it if you had it.
Yeah. This year by making my lentil soup. So even that, regardless of how you want to label your diet, I completely agree with you. Start small. And even if you are cooking more, that's such a great first step, right? It challenges you instead of going out, like picking up something on the road. And I think that everybody's biggest pitfall in their diet, honestly, is the eating out. At least where I live in New Jersey, people are busy. It's very easy to pick up food on the go. So when you are challenged by adding more plant foods to your diet, you're thinking, okay, well, I'll do this for myself. So I love that. So make your lentil loaves, people.
Yeah. And regarding that, think about ways where you can, it'll take a little planning, but say on the weekends, meal prep. So roast a bunch of vegetables, make a big thing of quinoa, and cut up all your fruit. And then you can put it together in different ways throughout the week. You can make a bowl, or you can make a stir fry, or you can just eat everything separately, or you can make a wrap, put it all in a spinach tortilla or something. I don't know. And then it's already kind of there. And so when you think about it, I don't want to go home and cook. Well, all you got to do is warm it up.
Yeah. Well, I think a big part of this, it's occurring to me. I love that you are also a health coach. You're not just a cardiologist, preventive cardiologist. You coach people and you give them these ideas. And that's what makes the difference. People need ongoing support. They need the ideas. You and I could probably, I realize, talk for a lot longer just about recipe ideas because we find it fun and it is creative. Not everybody does. So I think that that's, know thyself. If you need help with ideas, there are plenty of websites. You mentioned Forks Over Knives. I love that myself. But in any case, find somebody who can coach you and surround yourself with the tools that you need. I'm speaking to listeners that's going to set you on the right path to make these positive changes because it's not as difficult and overwhelming as we often make it to be. So you have to just keep coaching, keep giving people the tools that they need. I'll tell you one you got me thinking too. So I get a farm box year long. Mm-hmm. Love my farm box. I've had way too many sweet potatoes. So and I don't love sweet potatoes, but what I do love are my sweet potato and black bean fritters that are I have a cookbook, Tracy. So shout out to that. And it reminded me, I haven't made them in a while. I'm like, I have all these sweet potatoes. This weekend, I made my lentil soup and I roasted all those sweet potatoes to make the black bean and sweet potato patties.
Yeah.
So
there you go.
Yeah. All right. So this is so fun. A couple of things I want to ask too, and I'll be cognizant of time, but we can talk a long time. Our heart health is so important. It's a new year. We're headed into February, National Heart Month, and that's why I wanted to do this episode now to make people really aware of heart health again. So some of my favorite topics too that come up, and I want to hear from you, are inflammation, which you've talked about, fats, and then also caffeine. So I want your take on caffeine with heart palpitations and AFib and that. So is caffeine detrimental?
No, is the short answer.
Right. Okay. Thank you.
Now, the caveat is if you're drinking a pot of coffee every day, that's probably not good. And if you're drinking caffeine late in the day, that's affecting your sleep. So that's not good. But a cup or two of coffee in the morning, right, it is not detrimental to your health. Now, some people are sensitive to caffeine though, right? So some people, if they do drink a really strong coffee, I don't drink coffee, so I don't know those coffee drinks. But, if they drink something that has a lot of caffeine, they'll feel skipping in their heart and they just don't like that feeling. It's not dangerous, but they don't like that feeling. And if they cut back caffeine, that helps that. But it's not really been linked to atrial fibrillation or any serious problem.
How about dehydration and a lack of omega-3s?
Yeah, so dehydration, especially I live in Colorado, so everybody here is dehydrated, right? So staying hydrated is very important. Some people who have low blood pressure or are on blood pressure medications, if they get dehydrated, it can drop their blood pressure and that makes them feel bad, right? Woozy or dizzy. So yes, make sure you're drinking plenty of water. That's good for your health in general, right? Flushes your kidneys, keeps things moving and lubricated. So we want to drink plenty of water. Omega-3s are great for the heart. So yes, you can get omega-3s through your diet, right? Healthy fats like avocado and olive oil, nuts and seeds, fruits and veggies. You can take an omega-3 supplement. It doesn't have to be fish oil. I'm vegan, so I take algae-based omega-3. But omega-3 is good for brain health too. Don't forget.
That's right. Essential. Well, the balance of the omega-3s and the O6.
Yeah.
I've done other episodes on nutrition and fats, and I literally could spend hours talking about the role of healthy fats in the diet. And we did talk about that, but I'm a big proponent of getting seeds in your daily diet. A lot of people are snacking on nuts now, Tracy, as they go plant-based. disclaimer, I'm not plant-based, but I essentially am. I eat so many nuts and seeds and plant-based foods. So I make this, call it my plant-based breakfast bowl. And it's always some version of oats with hemp seed, ground flax seed, typically some pumpkin seeds, maybe a few pecans. So I put a mix in there, but I always pretty much daily include my ground flax seed and hemp seed.
Yeah, I do that too. I do a few walnuts in mine. Yeah.
And some fruit. So I love to share that. And it's simple and it's delicious. It's the way I like to start my day. So this is fun. I like very specifics that come up, and I'm curious about whether they come up in your coaching and working with patients daily, because there are so many misconceptions, particularly when it comes to nutrition and diet, as we know. And I thought that that's really important to set the record straight on things like caffeine and have people focus on making, again, these small changes in the right way. You know, if it's just sleeping more and hydrating better, and then slowly making those diet changes, right? And lowering their stress. So, okay, I know we've been chatting here for a while. My last question, though, is how about in your daily life? How do you focus on your daily self-care and heart health?
Well, all these things I've talked about, I try to do.
Okay. All right.
I try to practice what I haven't always, I grew up in Arkansas, and Arkansas is not one of the healthiest states. And I grew up in the 80s, right? And people weren't really concerned about their health, right? My parents both smoked in the home. I smoked cigarettes. I've done all of it, right? But I know that, again, it's never too late to change and focus on yourself. So I do all the things that we've talked about. I personally have sleep apnea, and I found that through a wearable. So sleep is like my kids get tired of hearing about. I can't do that. It's going to mess up my sleep, So I focus on my sleep. And again, as a physician, physicians are the worst. We're on call and we're up all night and we're residents in the hospital and we don't get any sleep. And then we're trying to take care of people with no sleep. So that's a whole other conversation. But anyway, so I focus on my sleep. I have a wearable. I check it. I keep a journal and check it and see what correlates with what. I'm vegan. I try to exercise. I found, even though I was going for a walk every day and doing some light weights, I found that I wasn't hardly ever getting my heart rate up from my wearable. So I added some more aerobic exercise to get my heart rate up more, some Zumba during the week or anything to get my heart rate up. I don't drink alcohol. You probably saw this week the Surgeon General talked about alcohol and cancer risk. Alcohol is bad for your heart, increases your blood pressure, increases your triglycerides, increases inflammation. It's bad for your brain. It's bad for your liver, increases risk of certain cancers. And, some cardiologists used to say, maybe there was that glass or two of wine a day is good for your heart. Well, we don't really say that anymore. So I think that's very important.
Important switch. I'm going to ask that, what's as far as recommendation goes, but that's a biggie. That's a biggie for people. And or those who are either completely removing alcohol, the teetotalers, or at least drinking less, because we recognize that pretty much the negatives far outweigh when it comes to alcohol.
Right. Because again, it's one of those things. What is the positive? So if I'm going to drink this glass of wine, what health benefits am I getting? Mental or physical? None. Right? None really. It messes up your sleep. Horrible.
It does mess
alcohol
up.
Does. Yeah.
Most people. But I have to point out on the blue zones, because I do love the blue zones, let's say, and here in the United States, we are not living in Sicily or and at 5 o'clock meeting our best friend for a glass of wine, right? Very lifestyle. So
yeah. And, I've heard people talk about how the wine is different there, right? It's made, again, more naturally, right? So maybe it has something to do with that too. Who knows?
Yeah.
Right. But we don't live in Sardinia, no.
No, we don't, unfortunately. So for here and now, I love that. Thank you for sharing all of that. I'll summarize it as saying it's never too early or too late to start, right? Focusing on your cardiovascular health for sure, and prioritize self-care. So thank you. I have one final question for you, and that is, what is one thing you are grateful for today?
I am grateful that I am in snowy Colorado in my nice warm house.
Nice. As the wind is howling here and I see snow on the ground, I will say the same. I love being warm and cozy in the winter months. I also love and appreciate the snowy mountains and skiing. I hope you get out and ski if you're a skier.
No, I'm actually not a skier.
I'm coming to
I live in Colorado, but I do not ski.
That's my favorite sport. So in addition to painting, and my best friend bought me some pickleball paddles. I've never played in my life, but she and I are going to start playing pickleball, and I decided I need to ski more because it's
I just took my first pickleball lesson last night. It was fun. You should try it. Yeah.
See, you and I are on the same page. Yeah. Have the set right here. Thanks to her, I can start. And my very final question is, where can listeners find you?
Well, the best place is probably on my website, www.hearthealth.care. And I do offer a free health consultation for people. So if they just have something that they want to talk about, I can give them a little guidance and how to connect with me more.
Fantastic. Well, this was wonderful. Such an important topic. And I wish you as well a happy new year, and keep it going with the preventive cardiology and coaching. And I would hope to talk again soon.
That's great. Thank you.
Thank you, Tracy. Thank you for taking time to join me and listen to this episode. You can find more information and subscribe to the Sense of Wellness podcast on our website at ccphp.net/sens. This show is brought to you by Castle Connolly Private Health Partners, a concierge medicine organization that partners with and supports exceptional physicians to deliver an unrivaled experience of comprehensive, collaborative, and attentive care for a preventative approach on health and optimal well-being for members. Be sure to listen in next time to the Sense of Wellness podcast, and remember, simple daily habits matter most.